Hi everyone, it's Jayne Green. Today I'm going to talk about 3 different types of depression. These are dysthemia, postpartum depression, and seasonal affective disorder. I'll be adding more videos as I make them into the playlist called Depression. So if you wish to be notified when these are uploaded, make sure that you subscribe to my YouTube channel and turn on notifications. So I'll first start off with dysthemia. About 2% of the American population have a depression type that's less severe than major depression, but it's still very real. This is dysthemia. Dysthemia is a type of depression that causes a low mood over a long period of time, perhaps for a year or more. People can function adequately, but not optimally. In other words, they can perform, but not at their full potential. The symptoms of dysthemia include sadness, trouble concentrating, fatigue, and changes in sleep habits and appetite. This depression type usually responds better to counselling than to medications, although some studies do suggest that combining medication with talk therapy, that is, counselling, may lead to the greatest improvement. People with dysthemia may also be at risk for episodes of major or clinical depression. Please go and have a look at the latest video that I made on MDD, major depression disorder. It's also known as clinical depression. The next type of depression is called postpartum depression. Did you know that a whopping 85% of new mums feel some sadness after their baby is born? But for up to 16% of women, that sadness is serious enough to be a diagnosable depression. Postpartum depression is characterised by feelings of extreme sadness, anxiety, fatigue, loneliness, hopelessness, and suicidal thoughts, and even fears about hurting the baby. Often they also feel disconnected from the child. This depression type can occur anywhere from weeks to months after childbirth. However, it almost always develops within a year after the woman has given birth. In other words, it usually doesn't show up years later. It happens within that year. Postpartum depression needs prompt and experienced medical care. This may also include a combination of talk, in other words, therapy, and drug therapy. In other words, possible medication. Now, the third and final disorder I'm going to talk about today is called seasonal affective disorder. Now, I'm going to ask you, would you prefer to hibernate during the winter than face those cold, dreary days? Do you tend to gain weight or feel a little bit blue and withdraw socially during the season? Now, if you do prefer to hibernate during the winter than face those cold, dreary days, and you gain weight and you feel blue and you withdraw socially, you could be one of 4 to 6% of people to have a depression type called seasonal affective disorder, or to shorten it, SAD, S-A-D. Though many people find themselves in what I call the winter funk, SAD is characterised usually by symptoms of anxiety, increased irritability, daytime fatigue, and weight gain. This type of depression typically occurs in the winter climates. This is probably likely because of the lack of natural sunlight. Now, we don't really know why some people are more sensitive to this reduction in light. Symptoms are usually mild, although they can be sometimes severe. This type of depression usually starts in early winter and lifts in the spring, and it can be treated with light therapy or artificial light treatment. Now, I'm not going to discuss that in this video, that is the light therapy or artificial light treatment. However, I will be adding a video in the future on light therapy. I urge you to also watch my latest video on MDD, that is Major Depressive Disorder. If you recognise any symptoms in that video or any of the symptoms here in this video, then it is vital you see your doctor. As seen in my video on major depressive disorder, there can be shrinking of neurons in the brain if major depression is not treated, leading to memory loss. Even if you have a mild form of depression, it is wise not to leave this untreated, for often mild depression can get worse and become major depression, known as MDD. This is also known as clinical depression. Clinical depression is a nightmare and far harder to treat, so please don't delay if you recognise any of these symptoms and seek your doctor's advice. There are many people who have major opinions about medication. However, the question you have to ask is, are they qualified to give you advice? Do they study the brain? Are they doctors and psychiatrists? I have spent much time studying the brain, and it becomes very clear to me that actual damage can occur in the brain if depressive disorders are left untreated. Synthetic drugs, in fact, replace the chemicals in the brain that we are missing and can help prevent damage to certain parts of our brain. Hence, it is vital for you to get your doctor's and or psychiatrist's opinion and advice. As I've said many times before, we only live once, so make sure you get medical advice so that the quality of your life improves and so that you can lead a happy life. I am sure that when you take your last breath, you will want to be able to say, I had a good life. In fact, I had a great life.